Have you noticed those twisted, enlarged veins appearing on your legs and wondered if they are simply a normal part of getting older? Many people over 50 ignore the first signs. A few small spider veins appear, then some heaviness in the legs, maybe occasional swelling after standing all day. Because there is usually no serious pain in the beginning, people often wait until the veins become more visible or uncomfortable. But here is something important you should know. Varicose veins are not just a cosmetic issue. They are a signal that the blood flow system inside your legs is under stress. Your veins have an incredibly important job. While arteries carry blood away from your heart, veins must work against gravity to bring blood back upward from your feet and legs to your heart. This is especially challenging because your legs are the lowest point of your circulation system. Inside healthy veins are tiny structures called valves. Think of them like one-way doors. They allow blood to move upward but prevent it from flowing backward. When these valves become weak or damaged, blood can begin to collect in the veins instead of moving efficiently toward the heart. Over time, the pressure increases, the vein walls stretch, and those familiar bulging or twisted veins begin to appear. But why does this happen more often as we age? One major reason is that the vein walls and surrounding tissues naturally change over time. The proteins that provide strength and elasticity, such as collagen and elastin, may become less resilient. This can make veins more vulnerable to stretching. Another important factor is muscle activity. Your leg muscles are not just responsible for movement. They also act as a natural pumping system for your veins. Every time you walk, climb stairs, or move your calves, your muscles gently squeeze the veins and help push blood upward. This is often called the calf muscle pump. But many modern lifestyles reduce how often this pump works. Sitting for long periods, standing in one position for hours, and reduced physical activity can all slow down blood movement in the legs. When blood remains in the lower legs for too long, pressure can build inside the veins. This is why varicose veins are common among people who spend many hours sitting at a desk, standing at work, or moving less as they get older. There are also other factors that can increase the likelihood of developing varicose veins, including family history, excess body weight, pregnancy history, and changes in hormone levels. For adults over 50, maintaining healthy circulation becomes even more important because muscle strength often decreases gradually with age. Less muscle activity means less assistance for your veins. Now, here is the good news. Varicose veins do not mean you have lost control of your health. While some cases require medical treatment, many lifestyle factors can support better circulation and help reduce discomfort. The key is understanding that the visible vein is only part of the story. The goal is not just to hide the vein on the surface. The goal is to improve the environment that allowed the problem to develop in the first place. In the next section, we will explore practical, evidence-based steps that can support healthy blood flow, strengthen the systems that help your veins work properly, and explain when medical evaluation becomes important. Now that you understand what causes varicose veins, the next question is the one most people ask. What can you actually do about it? The answer is not one single trick, cream, or supplement. Healthy veins depend on a combination of daily habits that support circulation, reduce pressure, and help your body maintain stronger blood vessels. Let's begin with one of the simplest but most overlooked factors, movement. Your legs were designed to move. Every step you take activates the muscles in your calves, thighs, and feet. These muscles help push blood upward through your veins. When you stay still for long periods, that natural pumping system becomes less active. This does not mean you need intense workouts. For many adults over 50, simple activities can make a meaningful difference. Walking regularly is one of the best habits for circulation. A daily walk helps activate the calf muscle pump, supports cardiovascular health, and keeps your legs moving. If you sit for long periods, try creating small movement breaks throughout the day. Stand up, stretch your legs, walk around your home or workplace, or perform simple calf raises. A few minutes of movement repeated several times a day can be better than being inactive for hours and then trying to compensate with one workout. The second important area is maintaining a healthy body weight. Extra weight can increase pressure on the veins in your lower body. When veins have to work against greater pressure every day, the risk of circulation problems may increase. A balanced diet focused on whole foods can support both your veins and overall health. Foods rich in colorful fruits and vegetables provide important nutrients that support blood vessel health. Berries, citrus fruits, leafy greens, and other plant foods contain natural compounds that help protect the body from oxidative stress. Hydration is another basic but important habit. Your blood is made largely of water, and adequate fluid intake helps your circulation system work efficiently. Many adults unknowingly drink less water than their bodies need, especially as thirst signals can become weaker with age. Instead of waiting until you feel extremely thirsty, make water a regular part of your daily routine. Another factor people often overlook is prolonged pressure on the legs. Long periods of standing without movement can be just as challenging as sitting for hours. If your job or daily routine requires standing, try shifting your weight, walking briefly when possible, and moving your ankles and calves regularly. Compression stockings can also be helpful for some people, especially during long periods of standing, travel, or when recommended by a healthcare professional. They work by applying gentle pressure that helps support blood flow in the legs. However, it is important to understand their role. Compression can help manage symptoms such as swelling and discomfort, but it does not replace healthy habits or medical evaluation when needed. Now let's talk about when you should not ignore your symptoms. Many varicose veins are not dangerous, but certain warning signs deserve attention. If you notice sudden swelling in one leg, severe pain, skin warmth and redness around a vein, or changes that appear quickly, it is important to speak with a healthcare professional. A doctor can evaluate your circulation and determine whether further testing is needed. The most effective approach is not waiting until the problem becomes severe. Your veins respond to what you do every day. Small consistent choices, walking more, staying active, eating a nutrient-rich diet, maintaining a healthy weight, and paying attention to warning signs, can support better circulation throughout life. Varicose veins are not simply about appearance. They are a reminder that your circulatory system needs support, and the earlier you pay attention, the more options you have. Remember, this information is for education only and does not replace personalized medical advice from your healthcare provider. If you found this information helpful, consider subscribing to Dr. Mark Plus for more evidence-based health information designed for adults over 50.